by Lakshmi. So today we will be discussing one of the important short note question from general pharmacology, which will be bioavailability.
What is bioavailability? By definition, it's nothing but the fraction of drug that reaches the circulation in its unchanged form. In simple words, suppose you have taken 100 mg of a drug, but in your systemic circulation or plasma, we only found 40 mg. So the bioavailable drug for your body is 40 mg. That is bioavailability. Fraction of the drug that reaches the circulation in its unchanged form. So suppose we are giving a drug through IV. It's IV. The bioavailability of that will be 100%. Why do you think so? Because IV is directly reaching the target organ. It does not undergo any fast pass metabolism or any other hindrance. So the bioavailability of IV is 100%. That is why during emergencies we are giving IVs. Now, the term bioavailability is commonly used for oral route. Mostly we will use it for oral route. Now let's discuss what are the factors which are affecting bioavailability. One is absorption. So of course if there is increased absorption, the bioavailability is increasing and vice versa. And absorption is it's affected by physiochemical properties of the drug, routes of drug administration, pH and ionization, food, presence of other drugs, area of absorbing surface, GI and other diseases. Apart from this, there is the most important first pass metabolism, hepatic diseases and enterohepatic drug. Now let's discuss what is this first pass metabolism and how it affects the bioavailability. Drugs gets metabolized and are removed or inactivated before they reach the systemic circulation. How? So from our gut wall, the drug through the circulation is going to the portal vein. When it's reaching the liver, it will undergo high metabolism. Inactive drugs may become activated, so whatever we have intended or wherever we want the drug to act, it won't be acting. It will get metabolized in the liver itself and it will reach the systemic circulation. Now as I said, the consequence of high first pass metabolism is that drugs undergoing high first pass metabolism are administered parenterally. So parenterally, example lignocaine, it's given through IV for ventricular arrhythmias, and dose of drug given through oral route is more than given by other systemic route. Nitroglycerin, which is given through the sublingual route. Nitroglycerin, which is given through the sublingual route. Now, second most important point is hepatic diseases. So in hepatic diseases, the bioavailability it decreases the drug metabolism. Usually in biohepatic diseases, it decreases the drug metabolism, which in turn leads to increased bioavailability. Sorry for the sound. An example, it is pronolol and lignocaine. Now third important point is enterohepatic cycling. Some drugs are excreted via bile, but after reaching the intestine, they are reabsorbed. So after getting excreted through the bile, when it reaches the intestine, they are getting reabsorbed to the liver, then to the bile and again to the intestine. And this cycle is getting repeated. Example, morphine and doxycycline. Now how we will calculate bioavailability? So there is this graph, which is the plasma concentration time graph. So we will be calculating the area under that graph to calculate the bioavailability. Suppose this is the graph for an 100 mg by given through IV. So this is how much this area under the graph is, and this is 100 mg of the same drug when we are giving it through the oral, and this is the area under the curve. Now, so by formula, bioavailability is the area under the curve. Oral, we have seen the small curve, right, divided by area under the curve through IV, which is the bigger curve. Now for the extra edge, you can also write about the bioequivalence. It is nothing but the two brands of the same drug are compared, like their bioavailability is compared. If both of the drug, the bioavailability is within the difference of plus or minus 20, it can be called bioequivalent. If it is not, it is bioinequivalent. That's it. Thank you.